Okay, distinguished colleagues, esteemed moderators, and respected speakers, and dear friends. It's a privilege to welcome you on behalf of the International Association Engagement in Adolescent Health, Voices of Adolescents and Youth from Latin America. I would like to begin by expressing our sincere appreciation to the moderators, Dr. Mauricio Scarpello and Dr. Ana Maria Moreno Restrepo, as well as to all the panelists and participants who have joined us for this important exchange. This webinar addresses a topic of profound significance for our field and for the future of adolescent health. Young people are not only the recipients of our efforts, they are essential partners in shaping the policies, services, and systems that affect our lives. Their participation is fundamental to ensuring that our work remains relevant, equitable, and effective. Within the IAAH Strategic Plan 2025 to 2028, we recognize that meaningful adolescent and youth engagement is not an optional complement to our mission, but a core principle that strengthens our advocacy, enriches our understanding, and improves the impact of our collective work. By creating structured and genuine opportunities for young people to contribute, we reaffirm our commitment to inclusion, shared liberation. This webinar offers an invaluable opportunity to hear directly from adolescents and youth in Latin America, whose perspectives and experiences are essential to advancing adolescent health and well-being in our region and beyond. Their voices challenge us, inspire us, and remind us that progress is only possible when young people are actively involved in the decisions that affect them. I am confident that this essential and that it will reinforce our shared commitment to placing young people at the center of adolescent health. Thank you very much, and I wish you an excellent and productive webinar.
Hello, everyone. Thank you, Dr. Maria del Carmen Cache. Good morning, good afternoon, depending on where you are connecting from. My name is Mauricio Scarpello, and I am an adolescent health specialist and currently vice president of the International Association for Adolescent Health for the Latin American region. It is truly a pleasure to welcome you to this webinar titled Youth Engagement in Adolescent Health, Voices of Adolescents and Youth from Latin America. This session is part of a broader initiative from the IAAH where we aim to create spaces for dialogue, learning, and exchange between professionals, but most importantly, with adolescents and young people themselves. Because today's focus is not only about adolescent health, it's about listening, understanding, and recognizing young people as key actors in their own health and well-being. In the next minutes, I will briefly introduce the framework of why youth participation matters, and then we will have the opportunity to hear directly from young people across Latin America who will share their experiences, perspectives, and insights. So thank you all for being here, and let's begin. So next slides, please. Now let's start with a quick question. Why does youth participation matter in adolescent health? From a global perspective, organizations such as the United Nations and the World Health Organization clearly states that adolescents are not just passive recipients of cares, they are right holders. This means that adolescents have the right to be informed and to be heard, and to be actively involved in decisions that affect their health. But beyond that, adolescents are also agents of change. They are constantly interacting with their environments, families, schools, communities, and they have the capacity to influence behaviors, norms, and even health outcomes, both for themselves and for others. And finally, they are key partners in improving health systems. When we include our lessons in the design, implementation, and evaluation of health services, those services become more relevant, more acceptable, and more effective. So, this is not just a theoretical idea, it is a shift in how we understand healthcare from doing things for adolescents to doing things with adolescents. Next slide, please. So, now, if we agree that participation matters, the next question is, what do we actually mean by meaningful participation? Because not all participation is the same. Sometimes participation is limited to consultation. We ask adolescents what they think about decisions or are still made by adults. Or other times, we move towards collaboration where young people are more actively involved in the process. And ideally, we reach shared decision making where adolescents truly have a voice and influence in outcomes that affect them. However, an important point to highlight is not all participation is meaningful. Many initiatives stop at consultation without generating real impact or influence, and that is a critical limitation. Meaningful participation requires intentional structures and genuine willingness to share power. Because when done properly, youth participation does more than just include voices. It improves the relevance, the legitimacy, and ultimately the effectiveness of health policies and services. So the challenge is not only to involve adolescents, but to ensure that their participation actually matters. Next slide. Slide. Now let's bring the discussion into our region. Why do voices from Latin America matter? Because Latin America is not starting from zero. Across the regions, there are already lived experiences showing that adolescents and youth participation is not only possible but also necessary. We have examples from community programs, schools, health services, youth led initiatives where young people are actively contributing to improving health and well being. These experiences show us something very important that when adolescents are given space, support, and recognition, they are able to engage in meaningful ways, bringing perspectives that adults alone cannot fully capture. And this particular relevant in the region like ours, where social, cultural, and economical contexts are diverse and constantly changing. So today is not about theory. It's about listening to real voices from real experiences. Can help us understand what meaningful participation actually looks like in practice. And with that, I would like to open the space to the most important part of this webinar, the voices of adolescents and young people from Latin America. So you can start. Luciana,
Okay,
you're next.
so good morning, everyone. My name is Lucia Sancho. This is a pleasure to be here today with all of you guys. I'm 14 years old. In my school, I am the National Junior Honor Society Vice President in my high school. We do community service, we represent our school, and we work with other societies around Costa Rica. We try to help other people in the school and outside the school. We represent student ideas, we do community service, we do a lot of activities for children and people that are in need. I'm also a competitive squash player here. I'm part of the Federación, and I love it a lot. I think that's something that helps us a lot with the mental health. I think sports can help us to be mentally good and happy. Next slide, please. Okay, so in our countries, for all of you to know, we are a country without army. That makes us a lot of to have peace. We also are famous about nature. We love to do hiking and visiting national parks. A lot of tourists love to do hiking and love to go around the nature. We also have local governments. We have a lot of types of sports. We also have music schools. Also, we are, well, most of us are Catholic and Christian, so we have Catholic and Christian faiths, and that provide a safe space for teenagers, and that causes a lot of good. Also, we have a very good social security health system, like la Caja Costarricense del Seguro Social. That's very important, and that helps a lot of children and adolescents and people in need. Something that we're not very proud of is bullying in our country. We have high things of bullying, and that's something that we need to improve on. Also, in our country, family and friendships are very important. We usually spend a lot of time with them, and that causes to have a great relationship with them. Okay, so for some organizations that we have, first we have Fundación Pan y Amor. So they do social research. For example, Escuchamos sus voces, that's some of what they do. They talk about sexual and reproductive health education in adolescents, and that helps adolescents to get to know more and get to know knowledge about voices on sexual health. Also, we have El Parque La Libertad. It is a cultural and social development center that is run by the Minister of Culture. Is a space that is basically focused on education and community growth, and that helps a lot of children getting to have those factors in them. Also, and that's something very important here in our country. Also, another society that we have is Soy Niña, and that's a volunteer program that people do if they want to in Costa Rica that supports girls and teenagers in their personal social development so they can improve in their social development, and that can have a great impact, a good impact on them in the future. Thank you very much.
Julieta, you're next.
Sorry.
Before the next speaker, our translation service is working now, so I put a link in the chat, and you can click that and then select the language you'd like to read the transcript in.
Para hablantes hispanos, la traducción está disponible en el chat. Pueden hacer clic en el link para acceder a la traducción. Go on, Julieta.
Well, hi everyone. Thank you very much. Good morning for everyone. My name is Julieta Saldombide. I'm 19 years old. I'm from Uruguay, and I'm currently a political science student in the University of the Republic. Uruguay is a small country located between Argentina and Brazil with a population of around 3 million people. But despite its size, it has a really strong cultural identity and a strong tradition of civic participation. It's an honor for me to be representing adolescents from my country and to share a part of our experience, challenge, and ways of being young in Uruguay. Next slide, please. Well, adolescent in Uruguay is strongly connected to community, friendship, and shared spaces. One of the most representative traditions is drinking mate. That is not just a drink, it's a social ritual. Young people gather to talk, reflect, and spend time together, and it often becomes a space when we can share what we feel and think, including concerns about life, of course. And public spaces are also very important. Many adolescents spend time outdoors in parks, that we call plazas, or walking along the Rambla, especially in Montevideo and Maldonado, that is where I'm from. These spaces become informal meeting points where social life happens, where real social life happens. And this is something that I forgot to put in the presentation, but football is a central part of our young culture in Uruguay. Many children start playing football from a very young age in baby football clubs, that we call it. And as they grow, football becomes a key space for socialization, identity, and even opportunities to the future. It shapes not only sport, it shapes routine, friendship, and a strong sense of collective passion for that is something really deeply rooted in Uruguay society. On the other hand, with social celebrations that I remember to put picture of, we have 15-year-old birthday parties, especially for girls, are often major events when we get friends and family together and dance all night. And speaking about dancing, Carnival is one of the most important culture expression in Uruguay. Many young people participate either as performance or as a part of the audience. A fun fact is that Uruguay has the longest carnival in the world. And finally, something I wanted to highlight is that many adolescents in Uruguay grow up in a context where education and rights are strongly valued. But inequality still exists, and not all young people experience these opportunities in the same way. And that is why participation is so important. Next slide, please. So, talking about participation in Uruguay, I have to talk about the CAC. By his acronym in Spanish, Consejo Asesor Consultivo, translated to Advisory Council. There is a council formed by adolescents who contribute to public policy by bringing up their perspective, experience, and concern. It's a voluntary carriage, and I was a part of it as a departmental council of Maldonado, representing other adolescents and participation in discussion both at departmental and national levels. In the CAC, we don't just share opinion. We build proposal, work collectively, and engage in dialogue with decision-maker public policies, especially those related to adolescent health and well-being, of course. This experience showed me that when adolescents are given real space to participate, we are not only capable of expressing yourself, but also of contributing with responsibility, ideas, and commitment. But something I really learned about in the CAC is that participation should not be symbolic. It needs to be meaningful, where adolescents are not only here, but also taken serious and included in decision-making process. So, from my experience, I strongly believe that when young people are involved in places like the CAC, in places like this webinar, policies become more connected to real needs and realities. Because we're not only the future, we are part of the present, and we have something important to say. Thank you very much.
Thank you, Julieta. Nicola, you're next.
Hey, hello, how are you? Hello, everyone. Um, my name is Nicolai Muela. I'm from Ecuador. I'm 22 years old. Um, an interesting fact from Ecuador is that it's known as the land of the four words. Why? Because we have the coast, the highlands, the Amazon, and also the Galapagos Islands. At the moment, I'm a psychologist. I work on a student counseling department, and also I have experience on leadership counselor. Please, the next. Okay, so how is to be an adolescent in Ecuador? It's really, really difficult to say like just one thing is how is to being adolescent in Ecuador because we have a lot of diversity, especially cultural diversity. But here we have the main characteristics that could represent the reality of how is to be an adolescent in Ecuador. First, we have that there is a lot of inequality of experiences. For example, the socioeconomic conditions and rural versus urban contexts. In the next characteristic, we have that there is a balance between the tradition and modernity. We have a lot of traditions, especially on the familiar environment, but there is also the influence of the globalization. So there is all the days a constant conflict. between the traditions and the globalization. And the third one, we have that in some cases, some adolescents or young people may have early responsibilities like take on work or in family roles at young age. This is because not all the families have the economic resources, so they should take these options. And then we have the growing of the awareness of social issues. Our adolescents constantly are exposed to social problems, increasing interest in mental health, equity, and environmental concerns. And this one has a link with the last one that is about the resilience and strength, because some adolescents may show adaptability, creativity, and a strong sense of community. This last one, I think, is the most important, not just to how is to being an Ecuadorian person, and it also means how is to being a Latin American person, I think. Please, the next one. So, in my adolescence experience, I have been participated in this first space. I like to call it like a social movement that it's called CEL, for its letters in Spanish, or its traduction could be Ecuadorian Loyola Camps or Campamentos Ecuatorianos Loyola. CEL is a space for youth movement where we can learn through a camp methodology. So it is not just like a funny travel with friends. It's an opportunity to learn about social concerns and for develop your social abilities. It's also a space where we have continuing education, where the older ones teach to the younger ones. And there is a special date in the years for sale that it's the holiday camps. That is a special camp for children from low-income families. Then we have two social movements. The first is the Movimiento por Ser Niña and Rodna. These are two spaces that helps us to show up all the voices of our boys or girls and our adolescents, and these voices help us to like a building for prevention of digital violence and develop of protocols. Thank you.
Hi. Good morning. My name is Sol Galeano. I am 20 years old and I am from Asunción, Paraguay. I'm currently studying international relations and I work in the public sector in a department focused on gender policies. There I contribute to initiatives that promote empowerment, equality, and inclusion of women in the country's social and political life. Paraguayan teenagers are known for our warmth, sense of humor, and ability to adapt to different realities. For example, bilingualism. Many young people use both Spanish and Guarani in our daily lives. This is an essential part of our cultural identity and how we connect with others. Social life and traditions. Social life is very active and closely connected to traditions. Gatherings with friends, sharing tereré or mate, birthdays, parties, and celebrations such as quinceañeras are important moments to come together. Sports, especially soccer, play an important role in young people's life. Music and social media platforms like Instagram and TikTok have also become very popular, where teenagers express their creativity, humor, and identity. Education and development opportunities. Being a teenager in Paraguay means growing up in a context where education is not always equally accessible. The education system faces challenges such as lack of proper infrastructure. Many young people must travel long distances or even leave school for economic reasons. In addition, many need to work from a young age, which limits their educational opportunities and increases social inequality. Personality and values. Despite these challenges, many Paraguayan teenagers stand out for their effort, commitment, and ability to overcome difficulties. Resilience is a key characteristic seen in both academic and social areas. Family, friends, and community act as support networks that encourage young people to keep moving forward. These connections strengthen values such as solidarity, empathy, sense of community, and the pursuit of their ideals.
Next slide, please.
Which are distinctive traits of Paraguayan youth. During my teenage years in Paraguay, I had the opportunity to participate in social action activities with different groups. Taking part in these experiences not only allowed me to help others, but also to develop skills such as leadership, teamwork, and empathy. It also motivated me to reflect on the importance of young people contributing, even in small ways, and having an active role in building a more just and inclusive society. I believe that these types of experiences are very important during youth because they help us grow in individuals and become actively involved in creating a fairer society. Thank you all very much.
Hello everyone, my name is Fernanda Bermea, I'm 24 years old and I was born and raised in Mexico City. I'm a medical doctor and I'm currently in my first year of surgical residency. So one of the things that matters the most to me is working with children because I believe pediatric care requires not only clinical knowledge, but also patience, empathy, and a very human approach. Beyond medicine, I'm especially interested in public health, community service, and the way healthcare can reach people in vulnerable situations. These interests have shaped the kind of doctor I want to be, someone technically prepared, but also deeply committed to compassionate care. Next slide, please. So being an adolescent or a young adult in Mexico, it's a very rich and complex experience. Family plays a central role in every life, and many young people grow up with strong connections to parents, grandparents, and their communities. At the same time, youth culture is very dynamic. Music, football, food, social media, friendships, and school life are uh, um, all important parts of identity. Mexico is also a country with strong traditions, but youth are not defined only by celebrations such as quinceañeras. Young people are also shaped by national holidays, neighborhood costumes, religion, and strong sense of belonging. In large cities like Mexico City, young people often become independent early because daily life involves long commutes, fast routines, and adapting quickly to challenges. At the same time, many of us grow up being aware of social inequality, which often creates resilience, empathy, and social responsibility. Next one, please. And one meaningful youth participation experience in my life was working through Hospital Infantil de México Federico Gómez in activities connected to migrant shelters, because Mexico is a key country between Latin America and the United States. We receive many migrant families in situations of vulnerability. As part of these outreach activities, we offered basic health consultations, guidance on prevention and hygiene, and support for families who needed referrals of further care. We also organized recreational activities for children, which were very important because they help to reduce stress, create trust, and give children moments of safety and normalcy. This experience taught me that healthcare is not limited to hospitals. It can also be a tool for dignity, solidarity, and human connection, especially when working with children and displaced families. Many migrants lose almost everything when they arrive into a new country: their home, their routine, their community, their sense of safety, and sometimes even access to basic rights. In that context, Hospital Infantil de México worked to restore at least one essential part of their lives, their health. For me, that means much more than treating symptoms. It means helping children and families recover a sense of care, protection, and humanity at a moment when they need it the most. Thank you very much.
Well, this will be my turn. Hello, everyone. I'm Bahia. I'm 20 years old. I'm an Argentinian, and I'm representing SACIA, which is an Argentinian Society for Adolescent Health. Next, please. So, what traditions represent Argentine youth? Asking this question to myself, the first things that come to my mind were like Argentine traditionalism, right? Camaraderie, afternoon drinking mate with friends, and Sundays eating barbecue with family. Because Argentina is known for being one of the countries with the most established community sharing practices. I mean, the community, it's very important to most of us, at least. Next, please. However, besides of all that I mentioned, of this strong feeling of community and all that, which is very important, there's also the reality for children and teenagers. Growing up in such a violently virtualized world makes it more difficult to play in childhood and connect in adolescence. And this creates more individualistic habits, difficulty in finding support systems, and a lot of loneliness and alienations for young Argentinians. Next, please. So, what spaces for youth participation exist in Argentina? Well, in my case, I have the honor to say that I live in San Justo La Matanza, which is known for having a municipality that works with organizations in different neighborhoods in need to help children and adolescents. With different organizations in each neighborhood, these organizations organize educational spaces to talk about comprehensive sex education, mental health, and social welfare, and in the organization of recreational activities for children and adolescents, reinforcing the ideology of struggle that playing is a right, not a privilege. Next, please. I also have the pleasure of sharing my experiences working at SACIA and the Consejo, which are organizations that work across generations to promote activities between professionals and young participants, fostering and building comprehensive mental health among Argentinian adolescents. Conducting research on the social situation of young people and developing developing general care activities for them, like content creation activities and youth participation programs. But then, what are we missing? I mean, what is the problem? Next step, please. The problematic that I would like to talk about, that I feel that is that all adolescent and young adults of Argentina are going through right now, is that in our country, we are going through a very difficult social period, and this is generating extreme individualism. This is resulting in many cases of depression and loneliness among Argentine adolescents and young adults, due both to the difficulty of entering the work phase and finally finding viable opportunities for personal advancement that is being very difficult in the period that our country is going through, as well as the lack of information regarding mental health and the absence of community spaces that provide comprehensive support for those who need it. Thank you.
Well, thank you guys for your participation. We can all agree that you are an example of resilience, of empowerment, and we're very proud of you. So we still have many problems in adolescent well-being and health. Violence is still a leading cause of death among adolescents in Latin America. Forms recruitment by armed groups and drug trafficking create displacement and also migration. Latin America, sadly, is the second region with the highest rates of adolescent pregnancy, and this contributes to school abandonment and poverty, and also high incidence of partner violence. In 2022, the WHO and UNICEF published a report called No Time to Lose: Health Challenges for Adolescents in Latin America and the Caribbean. This provide an overview of the situation in the region post-COVID-19. Apart from the issues I mentioned, the report emphasizes that empowering adolescents and involving them in the design and implementation of interventions is one of the key strategies to address these challenges. But why is adolescent involvement so unique? Continuing with what Mauricio was telling us, it has to do a lot with their developmental skills and strengths. Adolescence provides a special window of opportunity for social learning, adaptation, and creativity. The prefrontal cortex, which is key role in creativity and generating new ideas, has its activity enhanced in adolescence when they solve problems in experimental tests that require creative solutions. Also, the ventral striatum, which we usually relate to risk taking and impulsivity, can also be promote pro-social behaviors like cooperation and altruism. So they may be uniquely qualified to come up with innovative ideas to tackle societal challenges. The type pyramid is a youth participation framework, one from many I found, but this one I think is really comprehensive. It explains how empowerment of both the adult and the youth creates a balance for projects allowing bidirectional learning. The most common type of youth participation is being the vessel. What does this mean? Is when adults have total control of the situation, and one example is the relationship that students have with teachers in school. There's also the symbolic empowerment when they share a symbolic position in committees, and the pluralistic approach is when um, youth and adults are provided specific roles. For example, youth can brainstorm ideas and adults can recommend strategies for implementing them. And this way, there is learning and shared control for both groups. This is the ideal that we seek when we want youth participation. So, to finish, I want to tell you that most initiatives for youth in Latin America are other-centered. We require more empowerment and a pluralistic approach for these initiatives to work. And I encourage everyone here, not just in Latin America, but in the world, to continue working to get this pluralistic approach and enhancing youth voices. Youth participation promotes social and cognitive development, so it should be empowered not only by organizations, but also by schools. Youth's creativity, energy, and an urgency for results because of where they are in life. Everything happens so quickly that we don't have as adults the same urgency for results that they have. Those are unique qualities that can be nourished to target complex societal issues. And a development of a critical consciousness, as we can see, many of the youth that presented today have this critical consciousness, is key to promote youth participation. Thank you very much, everyone, for listening to us.
Thank you very much, Anna. Thank you, everyone. Thank you, all youth and adolescents that participated today in our webinar. We are very pleased to have all you here, and we are very pleased for everyone that have been up to here. Um, there were, I think, a few comments in the chat. There was a comment saying about I noticed there was a women and adolescent health department and wondering how adolescent boots young men feel about that grouping for the health care. I don't know if any um, young participant want to answer this. If not, we can answer with me or Ana Maria. We can translate if you need. Okay, Nicolai, do you want to answer?
Yes, puedo hablar en español para sentirme un poco más cómodo.
Okay,
Está-
okay.
Sí, bueno, yo pienso que estos movimientos están enfocados en poblaciones vulnerables. Es por eso que, y por lo general, los movimientos sociales o los espacios de escucha que se abren están enfocados en niños, niñas, adolescentes o incluso las mujeres. Entonces, tal vez es como que va más enfocado a poblaciones que tienen más probabilidad de ser vulnerables. Em, y tal vez
That's
existen varias problemáticas en la salud, por ejemplo, en la salud mental de los hombres que no están tan visibilizadas tal vez y por eso no existen tanto como respecto de los hombres.
okay. For the people that are listening, you can remember that you have the access for the link there in the chat for translation if you need. And he was saying actually that this was more focused to vulnerable communities, and that is one of the reasons why this type of organizations tend to protect and promote and and show the relevance of doing more things with women and adolescents and minorities as well. Um, so this was a fantastic webinar. Thank you very much for everyone. Congratulations to all participants. Hello and thank you very much. Okay, congratulations from the
There's another
Filipinas.
question, Mo.
Okay.
Do adolescents link into any of the child-to-child projects in Latin America? I'm not sure about it. Do you know this project, Child to Child?
No.
Yes. No, me neither. I haven't heard it in Latin America. I'm sorry. Ah, Susana is telling that in
You
Uruguay.
can mention in Uruguay, perhaps.
Yeah.
Well, we
Hi,
are very okay.
there's no
Where is
project named Child to Child here in Uruguay. I mean, in the CAC, we work and promote participation and dialogue between teenage and child to child, but no, there is no project name child to child, indeed. I don't know if that was what he mean.
Okay.
Perfect.
I don't know if you can hear me.
Yes.
Yes.
Hello,
Yes.
my name is Una. I work in Scotland. I'm now retired, but I was been involved with Child to Child since it started, and it is a health and education linked charity around the world where children teach each other about health. And there is one of their resources for young adolescents. Mostly it's for younger children, but it has been very effective in promoting the voice of children and has shown that children are very good at teaching other children about health issues. And I think is very similar to what you've all been describing, and maybe has the potential to participate or to work together with you, just to increase the participation. This has been such a great webinar. Thank you.
Thank you, Una, for your participation. Well, that sounds like a good idea. So for us to share, and definitely one project that we want to continue hearing about.
Thank you for everyone. And we this webinar, we tried to do it with the voice of young people themselves, and we are very this was a wonderful presentation. I love it. And so we'll see you all in the following webinars of the IAAH. I don't know if my Dr. Maria del Carmen Casha, do you want to close the session?
Yes, I'm very happy with this webinar because we have heard the voices of the young people. And it's very important to say that there are some things that are common in all the countries, no? It's Latin America. Latin America has many things that are common. One of them is the inequities. In each country, there are inequities, and we know that that's the base. If we can overlook that inequity, to be a better citizens, no? That's very important. And another thing is that participation is very important. It's like playing for the children, participate. But we need three things to participate. No, the first one is we need to be prepared to participate. So if we are in health or we are in well-being, we must know the data in our countries, or we must know how are the things, for example, in gender violence. So we have to know some things, no? And I noticed that these young people know that. No, that's the first part in participation. The second part is participate is when people hears us and not just hear us, but make us do something together with the other generation. And the third part, let us, the young people, participate. No? And that's the relation, the intergenerational relation, that it's not easy. I know it's not easy. I work many years with young people, and really it's spectacular. They have much creativity. I think that we must work together, but we have to be respectful. All people has their convictions. Young people has their convictions. So the idea is that we work together, because I am 70 years and I work with adolescents and young people. Now the participation is stronger of the young people is stronger. But I think that we have to do more, and that's a part that we, the old people, have to do. I don't know. I don't think that this is something like just for the young people. The old people has to think what percent of the world population is young, 25%, and only 2.4% of budget is for young people. So things are not good. We have to participate and make advocacy and continuing working. So thank you so much, Mauricio, Ana Maria, for all the speakers. It was delightful for me hearing you, because it makes me feel that I have to do more and more and more. And you're invited to our third webinar that will be June 23. And I think I see Risa here. Risa it's the VP from North America, and she will lead that webinar. Thank you, thank you, thank you. Bye-bye.